And that just goes to show you how powerful this exercise is. 10 years of sciatica gone after 1 minute of performing this exercise. Hey everyone, Steven here from Team Euphoric, and today I'm joined by my good friend, Johnny Bones, aka Boner. And today, Boner and I are going to be teaching you how to be your own therapist and treat your own low back pain. Most of the time when a patient comes to me with low back pain, it's going to be due to dysfunction in the lumbopelvifemoral complex. The lumbopelvifemoral complex is where your lumbar spine meets your pelvis meets your femur, or in layman's terms, where your low back meets your hip bone meets your upper leg bone. A lot of muscles are going to cross these joints, and dysfunction in any one of those muscles can lead to low back pain, but the four most common dysfunctional muscles that I see in my practice are going to be the psoas major, the rectus femoris, the gluteus maximus, and the hamstrings muscles. So those are going to be the four muscles that I'm going to be focusing on for today's video. Now, with regard to the actual psoas major, where exactly does it attach and what does it do? Well, it attaches to the anterolateral lumbar spine, anterolateral, antero-anterior in the front, lateral to the outside. So it attaches to the anterolateral lumbar spine, which is the front outer part of the lumbar spine, specifically the bodies of the T12 to L5. T12 is right up around here, L5 down here. If we count, L5, 4, 3, 2, 1, and then T12. So it attaches right over there, and then it also attaches to the transverse processes anteriorly. The transverse processes are these little things that protrude outward, and it attaches from the transverse processes of L1 to L5. So we have L5, L4, L3, L2, L1. And they end up going all the way to the lesser trochanter. So they go all the way from here to the lesser trochanter of the hip. With the hip, we have the greater trochanter, which is this big bone to the outside. If you were to feel on the side of your hip, that big protrusion, that is your greater trochanter. And then on the inside of the inner hip, that is where the lesser trochanter is. So because it attaches from the spine all the way to the hip, we know that it's going to involve actions at the lumbar spine, the pelvis, and also the femur. Because it attaches to the front of the spine, it is going to be involved in flexion, specifically forward flexion. When both psoas majors are activated, meaning the right and left side, it is going to just do your standard forward flexion with regard to the trunk. If only one of the psoas majors is activated, let's say your right psoas major is activated and your left is just dormant, then that is going to involve lateral flexion, so flexion to the side. Aside from that, it's also going to have an action at the pelvis. At the pelvis, it is going to anteriorly tilt the pelvis. So if you were to stick your butt out, that's an anterior pelvic tilt. So your psoas major is responsible for the Instagram model pose. Next, what action is it going to have at the hip? Well, because it attaches at the front of the hip, we know that it is also going to involve flexion of the hip. And those are the main actions at the hip. It is also going to do some lateral rotation as well, which is bringing the femur toward the outside. So it flexes the trunk when both psoas majors are activated. It laterally flexes the trunk when only one is activated. And then it's going to anteriorly tilt the pelvis. It's going to flex the femur, and it's going to laterally rotate the femur. Next, let's take a look at the rectus femoris. The rectus femoris is one of your quadricep muscles. And of all the quadricep muscles, this is the only one that actually crosses the hip joint. So it's going to have an action at the hip, whereas the rest of the quadricep muscles, they only cross the knee, so they have no action at the actual hip. The rectus femoris, it attaches from the AIIS, or your anterior inferior iliac spine. You have this big anterior superior iliac spine, and then right below it is the anterior inferior iliac spine. It attaches from there, and it goes all the way down to the tibial tuberosity via the patellar tendon and the patellar ligament. And because it crosses the hip and the knee, we know it's going to have some type of action at the pelvis and also at the knee. At the pelvis, because it crosses in the front of the pelvis, once again, it is going to be responsible for anteriorly tilting the pelvis, so bringing you into that Instagram model pose. And then at the knee, it is going to be responsible for extension of the knee, so straightening out your knee. That is the action of the actual rectus femoris. Next, we're going to take a look at the gluteus maximus. In order to do that, Boner, turn around and show everybody your gorgeous glutes. The gluteus maximus, this one over here, it is going to attach to the posterior iliac crest, to the posterolateral sacrum, all the way to the actual coccyx, and then it is going to insert into the iliotibial tract, or the IT band, and it's also going to go into the gluteal tuberosity of the femur. Now, because it crosses the posterior side of the hip, we know that it's going to have some type of action with regard to extension of the hip. Specifically with regard to the gluteus maximus, it is going to do posterior pelvic tilting of the hip because, again, it attaches to the posterior iliac crest. Because it attaches to the posterior iliac crest, when this muscle is engaged, it's going to drive that end of the pelvis down toward the floor, so it is going to be responsible for posteriorly tilting the pelvis. Next, because it also crosses the hip, we know it has some action at the hip, and because it crosses posteriorly to the hip, we know that it is going to extend the hip. So it is going to bring the hip into extension. If you ever try to kick somebody behind you, that's going to be your glutes that are doing the work. Yeah, it does extension of the hip. And then also because it crosses laterally at the hip, it's going to have some type of rotation, and specifically it is going to do lateral rotation of the femur or hip. And then also because it crosses along the side of the hip, it is going to be responsible for abduction of the hip. So the gluteus maximus muscle, it does a posteriorly tilt, it posteriorly tilts the pelvis, it extends the hip, it abducts the hip, and it laterally rotates the hip. Next, we want to take a look at the hamstring muscles. With regard to the hamstrings, we have 3 different hamstring muscles. We have the semimembranosus, semitendinosus, and the biceps femoris. With regard to the biceps femoris, there are 2 heads. There's a long head and a short head. Every single one of the hamstring muscles, with the exception of the short head of the biceps femoris, are going to attach to the ischial tuberosity, being this bone right over here. And with regard to the actual hamstring, let's get into each one individually. We have the semimembranosus, semitendinosus, and the biceps femoris. The semimembranosus is going to be the most medial of the hamstring group. And with regard to actually memorizing these ones, if you ever forget which one is which, just remember that semimembranosus and semitendinosus are right next to each other, and semimembranosus is the most medial. Membranosus has the letter M in it, medial has the letter M in it, so semimembranosus is the most medial, and then your semitendinosus is right next to it. Medial meaning closer to the midline. So the semimembranosus is going to attach from the ischial tuberosity all the way down to the medial condyle of the tibia on the posterior surface. The tibia being this big shin bone right over here, and because it attaches on the posterior surface, we know that it attaches on the back end of the tibia, and the medial condyle means the middle. So the inside back end of the tibia is where it is going to attach. Next, we have the semitendinosus. Again, the semitendinosus is also going to attach to the ischial tuberosity, and it is going to cross all the way down to the pes anserine, which is right in here. Can't really see it from that angle, but do a Google search, you'll find it. It attaches to the pes anserine tendon, and it is on the proximal anteromedial side of the tibia. Again, the tibia is your shin bone, anteromedial, anterior, front, medial, middle. So it is going to attach to the front middle end of the tibia. Next, we are going to look at the biceps femoris. The biceps femoris, again, we have 2 heads, the long head and the short head. The long head is the only one that crosses the hip. The long head is, as with the other 2, going to attach to the ischial tuberosity and also the sacrotuberous ligament. And then it is going to cross all the way down to the head of the fibula. The fibula is the bone located next to the tibia. It's this much smaller bone right over here. And with regard to the actual biceps femoris, the long head, it is going to attach to the lateral tibial condyle as well. So it goes from the ischial tuberosity and sacrotuberous ligament all the way down to the head of the fibula and lateral tibial condyle, right in that area right there. And then finally, we have the short head of the biceps femoris. The short head of the biceps femoris, this is the only hamstring muscle that does not cross the hip. This one over here, it attaches from the linea aspera, which is this line right over here, and it goes from the linea aspera and lateral supercondyle of the femur, lateral to the outside, and once again, as with the biceps femoris, it attaches to the exact same spot. It is going to attach to the head of the fibula and the lateral tibial condyle, which is right in there. And now that we know where exactly they cross, what exactly do they do? Well, every single one of the hamstring muscles, with the exception of the short head of the biceps femoris, because they all cross the hip, we know that it is going to involve extension of the actual hip. And because they attach to the pelvis as well, we know that it is going to posteriorly tilt the pelvis because it is on the posterior end. So when it pulls the ischial tuberosity down, that is going to bring the pelvis into retroversion or posterior pelvic tilt. And then with regard to the knee, this one right over here, all 4 of them, the semimembranosus, semitendinosus, biceps femoris, both long and short head, are all going to involve flexion of the knee. So whenever you bring your foot toward your butt, that is your hamstring working. Now that we know all of the different muscles that we are going to be working on, next I want to get into some mobilizations, some strengthening exercises, and also some myofascial stretches and ELDOA'S that you can do to help alleviate your low back pain. But in order to do that, I need to get changed first, so I'm going to just quickly change into my workout clothes. Let's get ready. All right, now that I'm all changed, we can go ahead and proceed with the exercises. In terms of the exercises, I'm going to be taking you through 4 different things. I'm going to be going through some mobilizations, some strengthening exercises, some stretches, and then some ELDOA'S. With regard to the mobilizations, you want to perform them in this order. It's mobilizations first, then strengthening, then stretches, and then at the end you would do your ELDOA'S. With regard to the mobilizations, these are all going to be related to the lumbar spine. With regard to the lumbar spine, ideally, a normal curve should be anywhere from 20 to 40 degrees of lordosis in the lumbar spine. In the 17 plus years that I've been assessing people, I would say most of the people tend to present with a flattened curve, so they have a hypolordotic curve, meaning they have a flat spine. So instead of having this nice curve, it just goes straight down. And then it's a little bit, it's not as common, at least in my own practice, but a hyperlordotic curve would mean more than 40 degrees of lordosis in the actual spine. So with regard to these particular mobilizations, it doesn't matter if you have a hypolordotic curve or a hyperlordotic curve. These can be applied to absolutely anyone. We are going to do 4 different variations of these mobilizations. We're going to do a 4-point mobilization, we're going to do a seated mobilization, then a tall kneeling, and then finally a standing mobilization. With regard to the first one, let's get to the 4-point. With the 4-point mobilization, you are on your hands and knees, and what you are doing for this one, you want to maintain a nice neutral spine, and then what this is also considered the cat-cow pose if you've ever done yoga, but what you are going to do is you are going to tuck your spine underneath. You want to roll your spine, so go into a hypolordotic curve, so really round it out, and then a hyperlordotic curve. So you really want to accentuate the hyperlordosis in your curve, and you're just going to do that for about 20 repetitions in each direction. Now this over here, we're working on flexion and extension of the spine. Another area that is very limited in a lot of people is going to be lateral flexion. So once we've done this, then we want to incorporate some lateral flexion for the mobilization. So for that one, you want to bring your hip toward your ear on each side. So you're just going to lift up the hip and then lift it up the other way. And you are going to continue to do that. Next, we are going to do the seated mobilization. For that, I just need to grab the Swiss ball. I will see you in 1 second. Okay, for the seated mobilization, it is essentially the same thing. We are going into flexion and extension of the lumbar spine. So we are going to stick our butt out, go into hyperlordosis, and then cave everything in and go into hypolordosis. And we're just going to do that for about 20 repetitions each. Then we would do some lateral flexion. So we are just going to go side to side. So just do a bunch of pelvic rocks. If you want, you could also do circumduction, so draw circles. And then a little bit more advanced, you can even draw a figure 8. If you guys need to get really good at hula hooping, this is going to be an excellent exercise for that as well. Once we've done the seated, quick note before I actually get on to the next one. With regard to these mobilizations, these are each progression. So if you would want to start with the 4-point and then later on build up to the seated, build up to the tall kneeling, build up to the standing. You don't have to do all 4 of these mobilizations in one sitting when you're working out. So start with the 4-point. If that's too easy for you, you can move up to the seated. If that's too easy, tall standing. If that is too easy, the actual standing one. But anyway, that's it for the seated. Next we have the tall kneeling. For the tall kneeling, you are on 2 knees and exact same thing. What you want to do for this one over here, you're tucking your pelvis underneath you, so you're going into hypolordosis, and then hyperlordosis, stick your butt out. Let me just go to the side now so you guys can see. Yeah, you're doing the Donald Duck, Pink Panther. Donald Duck, Pink Panther. Instagram model, flapjacks. Instagram model, flapjacks. Then we could also do the same thing, so we could hike up the hip to each side. That is the tall kneeling. Next, we are going to do the standing. For the standing mobilization, we are going to do the exact same thing. So we're going to go into a hypolordosis, so flatten out the spine, and then hyperlordosis, try to accentuate the curvature as much as you can. Hypo, hyper, hypo, hyper. And then for this one over here, what we can do is when we also want to raise the hips so we can get some lateral flexion. What you're going to do is go on one leg. So let's say we're working on the right side right now. You're going to go on your tippy toes, then you're going to go down, you're going to flex your knee, come back up. Tippy toes down, flex knee up. Let me just rearrange the camera so you guys can see what my feet are doing. Tippy toes, knee flex. Tippy toes, knee flex. You can put your hands on your hip as well, so you can ensure that your hip itself is pretty stable. But that is the standing mobilization. And now that we've done the standing mobilization, next we are going to do the McKenzie press up. With regard to this one over here, The last 4 that we just did, those apply to absolutely anybody because it's just good to get the spine moving around and get it nice and mobile. The McKenzie press up is specifically for people that have a hypolordotic curve, so a flat back. If you are somebody with a hyperlordotic curve, meaning excessive curvature of the spine, you would not want to do this exercise. So this one over here is specifically for people with a hypolordotic curve. Now, the reason that I'm choosing this specific exercise is because over the last 17 years, most of the people that come to me tend to present with a hypolordotic curve. So I don't want to get into every single exercise, but for most of the population, this exercise is going to be very appropriate. For the McKenzie press up, it is essentially you are getting into a push-up position or a cobra, if you have ever done yoga, but that is the actual exercise. Let's go ahead and show you guys. Okay, so with the McKenzie press up, a few things worth noting. Number one, the ASIS, which is this big bone right over here, we want to keep that pinned to the floor. So what we are going to do for this one is you want to go into hyperlordosis, so extend the lumbar spine as much as you can without letting your ASIS leave the ground. The reason that we do not want the ASIS to leave the ground is because this is a mobilization, not a stretch. If we allow the ASIS to leave the ground, then it is no longer a mobilization. Then we are stretching all of the musculature and all of the ligaments on the anterior aspect of the hip. We do not want to do that. We want to mobilize the spine. And in order to do that, the ASIS needs to stay pinned to the ground. So what you can do when you're first doing this, you can put your finger right underneath your ASIS and just get an idea of how high you need to go. Then once you have a good idea, then really get a feel for it and see how high. So for me, that's about as high as I need to go. Any higher than that, my hips are going to start to come off the ground, so I don't want to go higher than that. But this is the McKenzie press up. Great exercise, great mobilization for anybody with a hypolordotic curve, so a flat spine. Now, before we actually get onto the strengthening exercise, I just want to do a quick note on why exactly these mobilizations are so great. A lot of people are going to be very, very stuck and rigid in their lumbar spine. A lot of people pretty much the spine is responsible for several things: lateral flexion, extension, rotation. Most people are going to be very, very limited in rotation. Ideally, you should have anywhere from 3 to 18 degrees of rotation in the lumbar spine, and a lot of people are going to be very, very limited in that. So by doing all of these different ranges of motion, what's going to happen is you are going to start to create a little bit of space in the joints, and they're going to start to move a little bit more freely, which is going to greatly help with any issues that you are experiencing with pain in your lumbar spine. Now that we've done that, let's go ahead and start doing some of these strengthening exercises. With regard to the strengthening exercises, the first one that I want to do is the 4-part glute series. If you recall, when we did the little anatomy lesson at the beginning, the glutes are responsible for posteriorly tilting the pelvis. So because most of the people that I see come with an anterior pelvic tilt, then this is why I want to show you an exercise to help bring you into a posterior pelvic tilt. So this is a strengthening exercise for the gluteus maximus, which is going to help bring you into a posterior pelvic tilt. With regard to this, there's 4 different variations. Each one is meant to target different fibers of the gluteus maximus. You could think of the gluteus maximus, let's say this is the glute right over here. You could cut it up into 4 different quadrants. You have the lateral aspect, then you have the medial lateral aspect, you have the lateral medial aspect, and then you have the medial aspect. So you have 1, 2, 3, 4 different positions. Depending on how exactly you play with the level of abduction and adduction and internal rotation, external rotation, it's going to dictate which fibers you place an emphasis on. Real quick, I know you're going to say you can't isolate specific fibers, and that is true. You cannot isolate specific fibers. But depending on the orientation of the femur, which is your leg bone, you can emphasize specific fibers. So every single one of these exercises is going to target all the fibers in the glutes, but you can emphasize specific fibers depending on how exactly you place your feet. Anyway, I'm going to show you what I mean. We're going to go ahead and get on the floor. For the first position, this is going to be for the lateral fibers, so the most lateral fibers of the glute. What you can do is take a business card or a piece of paper, take a $20 bill, whatever you want, put it in between your knees. Your feet should be hip width apart. You want your knees tucked together. So this should not drop when you are performing the exercise. Then what you're going to do is you are going to lie down on your back. And in order to stabilize your scapula, you want to bring your arms to the glenohumeral angle, which is right around the level of your forehead. These are kind of in my way a bit, so I'm not going to be able to get quite at the glenohumeral angle. But what you want to do is you are essentially doing a bridge with this position right over here. So feet shoulder width apart. The navicular being the inside bone, so the medial arch. The navicular is the bone toward the medial arch of the foot. You want to make sure that that stays planted on the ground. So you're squeezing this, pushing the medial arch down to the floor. You want to put your arms at the glenohumeral angle. You want to look down with your eyes between your thighs. By looking down, that is going to put the dura mater on tension. And then from here, we are just going to go into a hip extension while maintaining a neutral spine. You want to try and lift the vertebrae of your spine one at a time. So try and do L5, L4, L3, L2, L1, T12, T11, and try and do that for each single exercise. This is the lateral fibers. Then, if we want to target the medial lateral fibers, so the ones that are just next to it, then we do knees together and also feet together. Same thing, navicular down to the floor. So we're pushing the arch down to the floor, looking between our thighs, arms at the glenohumeral angle, and we are extending at the hip. Same thing, one vertebrae at a time. That is the medial fibers. We don't need this anymore. Next, we're going to be doing the lateral medial fibers, which is the one right next to it. For this one, this is your standard hip bridge that you see most people doing in the gym. It is feet apart, knees apart. Same concept, navicular down, flatten out the spine, look down to activate the dura mater, arms at the glenohumeral angle. One vertebrae at a time, you are going to go into hip extension, and then lower one vertebrae at a time. So you're rolling the spine, and then unrolling the spine. That is for the lateral medial fibers. Then for the medial, so the closest to the butt crack, for this one over here, you are going to place your feet together, and then you want to spread your knees as far apart as you can without letting your navicular leave the ground. So you want to maintain a flat arch. If your arch comes up off the ground, you've gone too far. So you're just going to go as far as you can, which for me, that's about it. Same thing, navicular down to the floor, legs spread, maintain retroversion of the pelvis, arms at the glenohumeral angle, look down to put the dura mater on tension, and then one vertebrae at a time, you are going to roll and unroll. And that is the 4-part glute series. So we have the lateral fibers, which are knees together, feet apart. We have the medial lateral fibers, which are knees together, feet together. We have the lateral medial fibers, which are feet apart, knees apart. And then we have the medial fibers, which are feet together and knees apart. Next, we are going to get into the segmental strengthening and reinforcement of the hamstrings, specifically the proximal hamstrings. I'm going to show you a couple variations. One is going to be the proximal hamstrings, the other is intermediate. With regard to the hamstrings, if you recall, it attaches to the ischial tuberosity and brings it into a posterior pelvic tilt. So because most people have an anterior pelvic tilt, by strengthening these, this is going to help bring the pelvis into a neutral curve once again. Now, the proximal fibers, we have the proximal, the intermediate, and then the distal fibers. These exercises right over here are going to work the proximal fibers. If you've ever seen a Nordic curl, it's essentially 3 different variations of a Nordic curl in terms of the foot position. So the first one that I'm going to show you is for the semimembranosus, which is the most medial. Because the semimembranosus is the most medial, we want to place those fibers on the most amount of tension to get the most activation of the semimembranosus fibers. And in order to do that, we are going to place our ankles to the outside of our knees. And what we are going to do is a Nordic curl in that position. Right now, I don't actually have my Nordic curl set up, but I'm going to do the next best thing and just put a barbell underneath my heels, and I have some knee pads so I don't destroy my knees. This is also very, very uncomfortable, so I'm not going to be able to go all the way, because usually when I perform this exercise, there's some type of padding behind my Achilles, but I don't have that padding right now, and I'm a little BITCH, so I'm not going to go all the way down. But what you are going to do for this one is you want to hook your ankles underneath. Your ankles are outside of your knees to get a little bit more tension on the semimembranosus fibers, and then you are just going to hinge from the hips forward and then come back up. One thing that I like to do with this exercise, which I don't know why I'm not doing it now, but anyway, I end up putting gravity boots on my ankles. Gravity boots, it's basically a boot that you put around your ankle that has a thick layer of foam, and by doing that, you can go a lot deeper because you're not going to have the bar digging into your Achilles. So if you have gravity boots, do that. If not, I'll show you the intermediate fibers later on, and you can do that instead. But this is for the semimembranosus. For the semitendinosus, your ankles are in line with your heels. Same thing. Ankles are in line. You're just going to go as far forward as you possibly can. Most people, this is where they're going to be their strongest, the semitendinosus. Then for the biceps femoris is the most lateral. So because the biceps femoris is the most lateral of the hamstring muscles, we are going to bring the ankles to the inside. So you could pretty much get your ankles, your feet touching each other. And then it's going to be the same thing. You're just going to hinge forward, come back. And those are the 3 exercises for the proximal hamstring group. With regard to those, if you want to do the semimembranosus, ankles outside, semitendinosus, ankles in line, for the biceps femoris, feet together. Now, if you do not have that equipment available, or if you find it very, very uncomfortable, you could also do the intermediate fibers by getting on one foot and one knee like this. So what you could do, if you are doing the semimembranosus, ankle starts outside, and then you're going to curl toward the inside. For the semitendinosus, line your foot up with your ankle, line your foot up with your ischial tuberosity, so that bone right over there, and you are going to just bring it toward your butt. And then for the biceps femoris, you are going to start with your ankle on the inside, and then you are going to curl your knee toward the outside. And those are a few different ways that you could emphasize the intermediate fibers of the different hamstring muscles. Now that we've done that, we're going to start getting into the segmental strengthening and reinforcement of the subumbilical rectus abdominis, so the lower abdominals. With regard to this one over here, Boner, I'm just going to have you move over a little bit because I have no room. Same concept as when we were doing the supine hip extension, the 4-part glute series. We want to have our arms at the glenohumeral angle. Our eyes are looking down to activate the dura mater. For this one over here, some of the key points, we want our hips at 90 and our knees at 90. So we're going to lie down on the floor, arms at the glenohumeral angle, hips at 90, knees at 90, retroversion of the pelvis, flatten the spine. And for this one, we are going straight up and straight down. Straight up and straight down. This is the subumbilical. So because it's subumbilical, we want to raise our legs as high as possible so that all of the vertebrae up until the belly button end up lifting up off the ground. I'll show you what I mean. So you're going to go in this position, lift up, come back down. Come back down. It's a very small movement. You're not doing a whole ton of movement, but that is the segmental strengthening and reinforcement for the subumbilical rectus abdominis. Now that we've done that, we're going to go ahead and get into the stretching. For the stretching, and actually before we even get to the stretching, let me grab Boner real quick. The reason that we are strengthening the subumbilical fibers is because your rectus abdominis, which is your ab muscles, they attach from here all the way to the pubic symphysis. The pubic symphysis is this bone right at the bottom of your pelvis. When the rectus abdominis becomes engaged, it is going to lift up the pubic symphysis and bring you into retroversion or a posterior pelvic tilt of the actual pelvis. So by strengthening that muscle, if you have an anterior pelvic tilt, it is going to help to normalize it. Now that we've done that, we are going to do the myofascial stretching of the psoas major. If you recall, the psoas major is responsible for it does flexion, it does external rotation, and it does adduction. So in order to do the myofascial stretch, we want to reverse engineer all of those actions. So we are going to get on into a half kneeling position. Because it does external rotation, we want to go into internal rotation. So the ankle, you're going to bring it to the outside of your hip. Next, because it does adduction, we want to go into abduction. So we're going to bring our foot out and then just kind of roll our side over. Because it does flexion of the hip, we want to do extension. So we are going to push our hips forward. And then finally, because it is responsible for tilting the pelvis anteriorly, we want to go into a posterior tilt. Once we've done all that, we're going to bring the arms out. So we're going to flex our shoulders until it's 90 degrees. We are going to extend the shoulders, we're going to flex the shoulders, extend the elbows, and maximal external rotations of the shoulder. Another couple things that it does, remember, it does lateral flexion of the trunk. So because we are working on the right side, it does right lateral flexion. So we are going to laterally flex to the left. And then finally, we are going to rotate to the right. So real quick, I can go through all of those one more time in order to set up. Get first into a half kneeling position. Foot to the outside, move over. Tuck the pelvis underneath to go into extension, drive forward to go into hip extension, flexion of shoulders, extension of elbows, maximal external rotation. We are going to side bend away from the side we are stretching. We are going to rotate toward the side we are stretching, tuck in the chin, head up, and that is the position. For this one right over here, I actually did a video months back of myofascial stretching for the psoas major. I went into much more detail in that video, so I'm going to include a link right up over here. If you guys did not get all of the different bullet points from this, you can watch that. It's much more detailed. Next, we want to do the myofascial stretching for the rectus femoris. For the rectus femoris, remember, the rectus femoris goes from the anterior inferior iliac spine all the way down to the actual patellar tendon. So it is going to be responsible for hip flexion and knee extension. So we want to reverse those movements. What we're going to do for this one, pretty much the same position to start. We are on one hand, one knee, one foot, one knee. Then what we want to do is go ahead and grab our foot with the opposite hand. Then we would want to get into a nice tall posture. Retroversion of the pelvis. Arm up, we're going to do extension of the elbow, maximum external rotation, arm up to the side, and you are going to hold that for 30 seconds, and you're going to do that for 3 sets on each side. That one's pretty straightforward, not much to it. And that's pretty much it for the myofascial stretches. Next, we are going to do the ELDOA'S. With regard to the ELDOA'S, the first one that I want to show you is the L4L5 ELDOA. For the L4L5 ELDOA, this one right over here, our feet. And actually, before we even get into the ELDOA, the one that I just did, the rectus femoris, I'm going to include a link right up over here. Months back, I did a myofascial stretching of the rectus femoris. And again, I go into much more detail. So if you need a little bit more detail, check out that video. Now we're going to do the ELDOA, L4, L5. Feet are going to be in line with the ischial tuberosities. So these bones right over here, we want our heels in line with those bones. We're going to flex our knees to 90 degrees. We are going to dorsiflex, so point your toes toward your feet. Evert, so point the soles of your feet out. We want to push our knees down toward the floor. So we're going into abduction and external rotation with the knees. Then we want to maintain a nice tall spine. So we are going to get nice and tall. Extension of the elbows and wrists, maximum external rotation, and then straight up to the sky. Then we want to tuck in the chin, push the crown of the head up. With our eyes, we are going to look down to get the dura mater under tension, and those are all the different positions. So heels in line with ischial tuberosity, flex knees to 90 degrees, dorsiflex, eversion, activate your glutes by pushing your knees toward the ground. We want to get nice and tall with the spine, maintain retroversion of the pelvis, flat back, flex the shoulders, extension of elbows and wrists, maximum external rotation, up to the sky, tuck in the chin, push the crown of the head up. With this one, the whole point of the ELDOA'S, it's a French acronym, but it is a longitudinal osteoarticular decoaptation stretch. What that means, it's basically a fancy word for longitudinal. So vertical, we're creating axial extension. Decoaptation, we are creating space within a joint. Osteoarticular, osteobone, articular, where two bones meet. So joint. So basically, these are stretches designed to create space within a joint by creating axial extension. With all of these, we want to push the sacrum down to the ground, tuck in the chin, push the crown of the head up toward the ceiling to get that maximum axial extension. That was the L4, L5 ELDOA. And next, I want to do the L5, S1 ELDOA. This is going to be the last one. And before I actually do it, I just want to share a quick story, a couple stories. With regard to this ELDOA right over here, the L5, S1, this is, of all the exercises, the most beneficial, just in my personal experience from what I've seen in my own patients and from myself. So I'm going to share a couple of stories. This one is myself. I remember this was a few years back. I was on my way to Montreal for a course, and I ended up driving there. And the drive to Montreal was about 5.5 hours. About an hour and a half in, I just had excruciating low back pain. And I've had a history of low back pain because I used to do a lot of powerlifting and strongman type stuff. So on the way there, I didn't think I was even going to make it to Montreal. I had to recline my seat all the way back, and it looked like I was sleeping in my car. On the way back, same thing. My back was absolutely destroyed. So when I got home, what I did was the L5 S1 ELDOA for 1 minute every day for 3 months. 3 months later, I had to go to Montreal again. I drove in the car. My seat was straight up. And when I say straight up, I mean straight up. And the entire 5-hour drive, no pain whatsoever. And for me, that's amazing because typically anywhere more than 40 minutes before that day, I would always get a really bad burning sensation in my low back and in my cervical spine. And after I started doing those ELDOA'S, they completely went away. That's just my own experience. And then this was also about 3 years ago. I was in Arizona for another course. I was doing the level 3 medical fascial stretch therapy course, and I ended up renting an Airbnb, and the Airbnb belonged to this woman who was in her 70s. She ended up telling me, she asked me why I was there. I told her I was there for a course. I was doing the level 3 medical fascial stretch therapy. And she said, oh, you know what? I actually have a lot of pain. I've been having issues with my low back. I asked her what happened, and she said that she had sciatica. She said that for over a decade, she had sciatica in her left leg, and it was excruciating. She had numbness in her left heel, and because of that, she was unable to do cycling. She was an avid cycler when she was younger, and for over 10 years, she was not able to do any cycling whatsoever. She also had an MRI from something that she had done earlier. It was a few years earlier. She showed me her MRI. There was some disc degeneration at her L4 and L5, L5 and S1. So what I decided to do was I put her through the L5 S1 ELDOA. I thought that it was going to help her out, but I couldn't have imagined how much it was going to help her. Basically, I made her do it for exactly 1 minute. I did all the different cues, made sure that she was holding the tension very, very properly. And after 1 minute of doing that, she got up. Her back pain completely went away. She had no more sciatica, and the numbness in her heel, she had absolutely zero sensation before the ELDOA. After we did the L5S1 ELDOA, she still had a little bit of numbness. The sensation wasn't 100% there, but she could actually feel the back of her heel when she went to touch it. So her sciatica was completely gone. She ended up she had sensation in her heel again, and she was finally able to start cycling again after only doing that for 1 minute. And that just goes to show you how powerful this exercise is. 10 years of sciatica gone after 1 minute of performing this exercise. So with regard to this exercise over here, she was so happy after she ended up doing it that she left me the greatest review on Airbnb. I'm gonna read it for you right now. Her name is Beth. She's from Tempe, Arizona. I'll post it right up here so you can actually see it, but she said, "Stephen was wonderful. He was here as a trainer to learn some advanced techniques and showed me one stretch that I have probably already shared with 10 people, and it's been totally life-changing. He is so personable and focused and neat and clean. My only regret is I didn't get to spend more time with him because I was across town babysitting grandkids." Now, with regard to Beth, aside from her sciatica being completely gone and experiencing some sensation in her heel again, she was able to, after more than 10 years of not being able to ride her bike, she was able to start riding her bike again. So this exercise right over here is one of the most powerful exercises that I've ever done in my life. And over the last 5 years, this has been the best bang for your buck exercise for people with low back pain. If you do have low back pain, I would highly encourage you to try this exercise. I purposely saved the best exercise for last. This is, of all the exercise that I've done, if you're gonna do one exercise, this is the one. And so many people have low back pain. This can help so many people. Just one example, I know John Glad Van Damme, AKA Obese to Beast, he's been having a ton of back pain over the last almost year. So John, if you're watching this, definitely do this exercise. It is going to be a tremendous help for your back. But anyway, let's go on and demonstrate the L5S1 ELDOA. Okay, so for the L5S1 ELDOA, ideally you would want to be against the wall. You can also do this with a partner, but if you don't have a partner, the wall is going to be the best way to do it. What you want to do is get your butt as close to the wall as you possibly can. You're going to flex your hips to 90 degrees, and you want to extend your knees. You want to have maximal extension. You want to try and get your heels away from the actual wall. One of the reasons why we are propping up our legs is because we want to try and keep our core relaxed. We don't want to engage our core. What we're going to do for this one right over here, again, we're going to start by just shimmying our way up to the wall. Next, what we want to do, extend the knees, maximum extension of the knees. We are going to dorsiflex, invert, and internally rotate our feet so that they are not touching. You do not want the feet touching for this particular exercise. So we're flexion of the hips to 90, full extension of the knees, dorsiflex, invert, internal rotation, tuck in the chin, look between your thighs to put tension on the dura mater. Then we are going to extend the elbows and wrists, maximum external rotation, bring the arms up. Then we are going to push the crown of the head out that way. With regard to this one over here, we want to push the sacrum down to the floor. The heels, we want to drive them up to the floor. So it's down, up. We're going in opposite directions. Now, physically, you can't really do it, but you want to have the intention of doing that. So you want to push the sacrum down and have the intention of pushing your heels up, gliding them up the wall. Then with our spine, we're going to do the opposite. So our sacrum, we're going to push it into the wall, and our hands, we are going to push away from our body. So imagine that somebody is pulling you from both ends horizontally and pulling you from both ends vertically. Flexion of the hips, extension of the knees, dorsiflexion, inversion, internal rotation, look down to activate the dura mater, tuck in the chin, push the crown of the head out that way, sacrum toward the wall, sacrum down into the butt, flatten out the lumbar spine, heels up, extension of elbows, extension of wrist, external rotation, maximum. Flex the shoulders to get them in line with the ears, push away, and you are going to hold that for 1 minute. Now, with this one right over here, there are a lot of steps involved, and you may not have gotten it 100% from seeing it right now. So I'm going to include a link right up over here. I actually made an ELDOA video a couple of years ago, 2-3 years ago. So if you want to do this one exercise and do it correctly, every single step, it is listed step by step in that video. The audio quality isn't the greatest, but if you go in the description section, I have the notes of everything that you need to do for that. But definitely, if you have low back pain, check that video out because that is one of the best exercises that you can do to help with your low back pain. But that's pretty much it for today's video. If you enjoyed the video, be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.